Hello, and welcome to Pharmside Chat with Pitt Pharmacy. I'm your host, Aaron David-Nathan, and I had the privilege of sitting down with two of our awesome alumni from the class of 2016, who also happen to be my classmates. We spoke about the career paths after pharmacy school, their involvement with the School of Pharmacy, and words of wisdom. In our conversation, we learned a lot about how Pitt Pharmacy prioritizes engagement with our alumni network. So let's get started. All right, Janetta, Kelsey, thank you so much for being here with us. We appreciate it.
Thanks for having us. Of course, happy to be here.
Hard to believe it's been 10 years, right?
That's crazy. Flew by.
So in those 10 years, maybe if you can explain, Janetta, we'll start with you about your career paths following graduation.
Yeah, happy to. So I really started in the managed care pharmacy space. So I was at UPMC, Presbyterian Hospital. At that point, I really knew I wanted to do the business side. They pushed me to UPMC Health Plan as an intern because I kept asking about coverage of medications, how much they cost, and who will get it. After that point, I actually did a managed care residency at Highmark Blue Cross Blue Shield. So I am local to Pittsburgh and have remained in Pittsburgh throughout the years as well. And after the year, I had to think about, do I want to stay in the same company or go somewhere else? I really did stay because there was a lot of growth happening at the time. So I was there for almost 5 years and had the awesome privilege of meeting every pharmaceutical company that would come in and present their drug information. And for me, that was a highlight to really network, connect, and meet these scientific experts. So I jumped into pharmaceutical industry 5 years ago.
Wow.
I started with AbbVie. It's a global pharmaceutical company, over 55,000 employees. But I feel like I found my people in a way. Like I fit in because it was so diverse and we cover over 30 products. So I just feel like I'm constantly learning. I was out in the field initially as a medical outcomes science liaison. And after that point, I made the leap to go more in-house. So right now I'm on the medical payer strategy team as an associate director, which I love because it's a turn in terms of what I do. But at the end of the day, I still feel like I am doing something that's much larger scale, affecting large number of patients, and it's millions and millions. But at the same time, I'm using my business brain to drive strategy and being super cross-functional with working with people outside of pharmacy, which I love as well.
Okay, great. What about you, Kelsey?
Sure. So after pharmacy school, I completed an ambulatory care residency at Allegheny General Hospital. And if you would ask me when I was in pharmacy school what I'd be doing 10 years later, I would have said being an ambulatory care pharmacist. But my career has taken a couple different paths since then. I'm also local to Pittsburgh and have been for the last 10 years. And after my ambulatory care residency, I made the leap into managed care. So I spent about 5 years in the managed care space. I worked for both UPMC Health Plan and also Highmark Health. At Highmark Health, I was in the population health pharmacy space and really enjoyed it until about 5 years ago. I also made the jump to industry and transitioned my career to industry. And I worked at Indivior in the substance use disorder space on our medical communications team until last fall. And now I'm an associate medical director at Supernus. And I work in the postpartum depression space. So really excited to be an advocate for new moms. I know myself and many of my friends are new moms and really excited to be in that space currently.
You both hinted at this, and I think this is great based on your career paths, but how's your perspectives on the profession evolved since graduating? Maybe, Janetta, we can start with you because I think you've talked a little bit more about the business aspect as well.
Yeah, it's been an entire evolution. When I was in pharmacy school, majority of the students, even in our class, went into retail or hospital. Now I'm seeing, I would say, the bigger picture. What else can pharmacists do out there in the real world? And I think that's something that I wasn't as exposed to. I would say I loved kind of the conferences that we were able to go to, the networking, and even the leadership kind of opportunities we had. But at the same time, time, the evolution is more in where are pharmacists now needed. Number one, AI is taking over, technology is taking over. So a lot of jobs that are very operational based are really being cut down, while the positions that require a lot more brain power that in a different way in terms of being able to work in different teams and being more creative is something that I never knew about. So even right now, I'm working with the government. And I think the evolution now is that pharmacy is very much impacted by legislation with Inflation Reduction Act for Medicare line of business, prescription drug advisory boards for Medicaid, but also globally. So I think I always had a very US landscape, but now going more global, I see the opportunities that we have as pharmacists. Being in the US, you can work in a global aspect with MFN and most favored nation pricing. So I think what we need to stay very closely looking within the news is one is the context of AI and what will happen with technology.
Right.
And then number two is legislation, because I firsthand work with the government now within my position, and I'm seeing how it is changing everything with pricing, and the pricing of medications in US will dictate what types of jobs pharmacists will have as well.
Wow, okay. What about you, Kelsey? How's your perspectives changed since you had graduated on the profession?
Sure. So I echo a lot of what Janetta has mentioned. And I think really being in the profession over the last 10 years really opens your eyes to really what you can do with a PharmD. And I know they say that to us. They mentioned that to us a lot when we were students. But it really wasn't true until you could see the different opportunities and really what those career opportunities look like for a PharmD. And I think the other thing that I've really been able to see is how valuable our skill set and knowledge is within our careers and within the profession. And we can really bring something to the table, especially working interprofessionally alongside many other professionals, really bringing that specific skill set to the table.
Yeah, and I think so. There's a lot of opportunities for folks with a pharmacy background. So if you rewind the clocks back maybe 10 years when we were students, were there any experiences that you remember vividly that you enjoyed when you were a student?
I think one thing that comes to mind is definitely our classmates and close friendships that we were able to form during our time at the school pharmacy. I know Janetta and I have remained close friends and close contacts throughout the years, and I think it's really important as we think about our next, even myself, like next career moves and understanding what my classmates have been doing and understanding where a lot of my friends have transitioned in their career and still learning from a lot of our classmates to this day.
Yeah, right. What about you, Janetta?
Yeah, I feel like that baseline of friendships is also what stems into networking. And I think that part is very critical with pharmacy because pharmacy is a very small world. So even what we did with Lambda Kappa Sigma, those friendships have remained. But I would say it's also the unique experiences for me stand out. So the ability to go to conferences, for example. I attended my first one, and it was over 10 years ago. And then just 2 weeks ago, I attended my 19th AMCP conference. So it adds up, but it's just that ability to see it through the years. And number three is every time we had a guest speaker. I feel like when you have a guest speaker, you can have a coffee chat with someone. That is really where I started to click in terms of what I want to do. So that part was definitely helpful in pharmacy school. And then also just, I would say, the unique ability that Pitt Pharmacy really stands out as a school. It's a very strong school academically, but also with the experiences they provide. I now take rotation students, so I see the caliber that comes in, and Pitt Pharmacy students are always on top in terms of their application, what they do. So it's nice to see that they still keep it up and are improving really the students and what they're doing.
I think that's a good point. You said that the students are on top, which I totally agree
always.
with. Now you take students on rotations, you've mentored students through there, as well as being involved with the Student Industry Organization Symposium. What motivates you to remain engaged as alumni? And Janetta, will begin with you.
Yeah, so I remain as an APPE preceptor as well, taking students. And I think for me, it's because the learning goes both ways. I personally love having a buddy with me on all my calls, working on projects to explain things, but then they also provide this fresh, new perspective that is very different and unique. So every time I bring them in, I notice this kind of pivot into like, yes, they're great at technology, marketing, making videos or data analysis. So I'm constantly learning from them, but I also am the co-owner of the Pittsburgh Pharmacy Network. And that is really my way to really understand students because they come, they network, and I just see the need for them to have mentors because they are constantly interested, let's say in industry or managed care, but they can't get an experience. It's very tough to get an internship. Now it's tough to get fellowships. So having that mentor that can be that soundboard, you can text them. And also I am on social media and I have a lot of students that connect with me there. So I just see when their eyes light up or I see them being inspired, for me, it kind of like, that's why I do it.
Oh yeah, no, that's great. What about you, Kelsey?
Sure. So I agree with Janetta. I think continuing to be a mentor to the current students is really impactful. And the students that I've had on rotation as well have taught me something new every day that we have them. I'm truly inspired by our current pharmacy students and the wealth of knowledge that they know.
Yeah.
And I think back to our time in pharmacy school and I'm like, wow, this wouldn't have even been on my radar when I was a student. So I'm really impressed, like Janetta had mentioned, with the students that come through rotations and continuing to want to give back and teaching the next generation of pharmacists. I would say along with the API rotations, I would encourage other mentors to think outside the box as well. I've been able to establish a special topics course and special topic project with the School of Pharmacy, where in my previous role, I was able to take third-year pharmacy students and have them complete work on our team for course credits at the School of Pharmacy. And that was, I think, a tremendous experience for both the students and for our team. And something I'm looking to potentially reestablish in the future in my new role as well. So thinking outside the box, always looking for new opportunities and different ways to connect with the students. As Janetta has mentioned, it can be incredibly hard and challenging sometimes for the students to be able to obtain those unique experiences that may shape their career. But I think the School of Pharmacy does a tremendous job, especially with the fourth year API rotations and having those really great experiences available to our students.
I think that's a great point because if we want more alumni to be engaged with the students, which I'm sure students would appreciate as well, is like you said, to be creative with it through courses, as you had mentioned, Kelsey, or even some other ways that are not necessarily on paper, but can be helpful for students. You know, when we think about sort of the skill set that we want students to have upon graduation, that we try our best to instill in them, in your work, in your line of work, or even in your journey, what are some of the key skill sets that you've identified that students should have either during pharmacy school, after graduation? What are some of those skill sets?
I would say what I see, number one, is that a lot of students see the end game, but don't understand the process that it takes. They're like, I want your position, exactly what you do. But I always teach patience. Like, you need to grind. And I think that skill set has been not forgotten, but there's a lot with like boundaries of, okay, I'm not going to overwork all this. You almost have to. Like, you have to put the hours in. You need to do the jobs that may not be that much fun, that may have a lower salary, but you have to do that to be exposed to different types of positions, to talk to patients. A lot of students skip that step, and that step is critical. You need to understand the disease states, how it affects the person, all of that, but also to remember that every day is an interview, wherever you are. So I think being very presentable and professional, that part has almost been lost a little bit, but just remembering that how you perform on a rotation, on an internship, you might see that person in 10, 20 years, and they might hire you or not, or see you or not, I'm in pharma, based on how you perform that long ago. So it's really, I think it's the soft skills that are very traditional, like sending a thank you or a letter, that are almost forgotten. But also the number two skill set, I would say, with the time and the climate now is like, you need to find your niche or something that you are good at and being true to yourself. For example, like I've always loved business, the data side. So I see students that come in that might be really good with Excel. And I'm like, capitalize on that, like keep going with that. Or they might understand politics really well and how legislation works, do that as well. But always remain true to yourself. I feel like it's very obvious when you're being someone you're not. Like, know what your skill set is, be yourself, and be kind and respectful. So again, like I know it's very baseline characteristics, but that's what I see lacking the most, I would say, in students now. So just to not forget it.
No, I think that's great. Those are all very important skill sets that you may not realize that you need to develop until you're actually in the workforce. So I think that's a very great insight.
Yeah.
What about you, Kelsey? Maybe about sort of the way that you identified some skill sets. Janetta may have mentioned many of them, but some additional ones that you've identified in students that would be important for them to develop during pharmacy school and certainly after graduation.
Absolutely. A couple that stand out to me are team, working as a team, as a solid team member, in ways that you might not anticipate. I know during pharmacy school, we're always just looking to that next exam, looking to get the project completed. And I think even just reminiscing on some of my experiences at the school, we did a lot of team building and teamwork. However, that truly is foundational into being able to work with different teams, whether it's interprofessional, whether it's on a team of consistent of all pharmacists, whether it's a team of senior leadership and bringing in executive leadership. Those skill sets will be with you throughout your career. So really understanding and learning how to work as a team is like I said, really foundational. And the other is leadership. And I know everyone's minds always go to leadership equals managing a team or managing others, but not necessarily. You may have many leadership positions or leadership roles and not directly manage others in the formal sense. So capitalizing on how to be a good leader and a transformational leader can be really beneficial as well.
Yeah, and I remember when we were students, you both were leaders of organizations, so that's very important. Well, hard to believe it's been 10 years, since we graduated. It almost just seems like yesterday. So thank you both so much, for being here. I think, from the school's perspective, it's always great to see alumni remain engaged with the school. So I appreciate it.
Thank you, Aaron. Thank you for having us.
Yeah, it's great to be back. So thank you.
Absolutely. And thank you all for joining us for this conversation with our awesome alumni. We hope you found it insightful to learn about how our alumni stay connected with us at Pitt Pharmacy. If you enjoyed this conversation and want to see more, please like and subscribe so you won't miss out on how Pitt Pharmacy improves the health and well-being around us. Till next time, thanks for watching. Hail to Pitt.